was walking through the partial denture department the other day, and I noticed something that you may not be familiar with. I certainly wasn't familiar with any of these attachment systems before I started practicing here at Glidewell, and I want to talk a little about resilient attachments. Resilient attachments being defined by, attachments that have these kind of little plastic inserts in them to help connect a partial denture to a fixed crown or bridge, for example. And so if we look at these resilient ones, we call them resilient because they're, plastic and they can be replaced and they go in and out, versus like a precision attachment that's milled, where we have it milled into the distal of the crown, and then we have a metal male, for example, that's going to fit in that metal female. That metal on metal contact definitely can wear and will wear over time. In fact, the manager of the department, Jerry, always tells the story that I think about, and he was somehow able to keep his Toyota for 520,000 miles. And he had to replace the keys twice because of the metal and metal contact of the keys going into the ignition. And so that's always kind of a weak spot, and that's one of the reasons why we prefer resilient attachments, of course, like one of these attachments that will fit in on an ERA. And it's not metal to metal. We've got plastic against metal, and it's easy to replace this part should it become worn or should you want extra retention. So the bottom line is we'll work with any attachment system that you want to. We just have a couple, two that I'm going to highlight today that we know work really well for doctors who don't do a lot of these types of cases. And we just want to do whatever we can to ensure your success the first time out, so you're not having to redo these a lot. So today we're going to kind of highlight two of them. The ERA attachment, and you're probably familiar with these if you've ever done any kind of attachment on a partial. This is where the female comes off the back of a crown such as this, and then the male is the plastic part that's going to be housed in the partial denture. And we're also going to look at another attachment called a strategy attachment, and this is from another company called Rhein 83 in New York, Rhein, R-H-E-I-N 83, the year they were founded. And this is going to have the male on the crown itself, and it's a rather streamlined, rather small attachment that you can see there. And then the female is actually going to be housed inside of the partial, and I like these attachments. Nothing against the ERAs. The ERAs work very well. The only issue, if you look at these side by side with the ERAs, you can see you need extra room, which oftentimes is available. But a lot of times when it comes time to replace the attachment that's going to fit into here, it comes in the form of kind of the metal casing and the little, again, retentive device that goes inside of it. But when it comes time to replace this, you have to cold cure this, the metal housing inside of the denture, and dentists get worried a lot of times about cold curing when they have to set this on top of this and cold cure it into the denture. And they worry if they're going to lock it in by putting cold cure acrylic around here. If it gets underneath this attachment, they have to block it out to keep it from locking in. But it can also go around onto the mesial of the crown and lock in there, or lock in between this crown and another adjacent crown. And so there's a lot of worry or concern on the parts of the dentist sometimes with the ERA about using the cold cure to put a new casing into it. And so that's one of the differences that we see with this strategy, is that because the male is on the crown itself, the female actually fits into the partial. So when we snap down this framework onto the strategy, the male will fit into here. And over on this side, I actually took out the attachment, so you can see the metal housing and what that looks like. And as you can probably imagine, it's pretty easy to be able to put a new one of these into this housing over here. You can just use a barred Parker and cut that out. I would not recommend using a burr. It's really easy to kind of bung up the inside of that with the burr. There's a placement tool that fits right into there to put a new one in here, and you can kind of see that it's indexed. You can see that line about halfway around there and see that it's indexed, so when you snap one of these in, it fits right into place in the metal. And so we don't have to use cold cure acrylic, and we're never worried about getting one of these to fit in there again because of the metal housing. If we flip this over, you can see where that metal housing is going to be on the outside of that. And so that kind of takes up a little extra space there, kind of like the attachment does on the ERA. You're going to need some space somewhere to use these attachments. And by the way, when you look at this and you see all of this hanging off of the back of here, you might think to yourself, wow, that looks like a lot of force. That's quite a lever arm on the distal of that crown. What's that going to do to the periodontal status of the tooth versus this? Look how small and streamlined that is on the tooth. But keep in mind, because these are resilient attachments, and we've got the silicone, the vinyl attachment that's in here, because it's resilient and not metal to metal, we've got some play in this system, and it's really not going to crank it. We have not seen more teeth be lost for periodontal reasons to these ERA attachments versus the strategy attachments. So you don't have to worry too much about that, but it's definitely easier to replace one of these inserts on the strategy because there's no cold cure acrylic. You're just fitting this little resilient attachment into the metal housing that's been made. And you've got a couple of different ones. You'll notice that this one that's in there now happens to be the pink. That's the soft retention. It also comes in a white, which is the standard retention, and a yellow, which is the extra soft retention, just based on how hard the patient wants to work to have to take this out. And so it snaps into place right onto these restorations, and you can kind of hear it click into place as it goes in there, as it fits in there, and so it snaps on well. And I do like the idea of having the male on the crown and the female inside of that metal housing. And if you look at the refractory model, once we decide to make this, when it comes to a pickup impression, by the way, easily the most common thing that we see happen with the dentist is that they will try these crowns in. Let's say you've gotten these back from the laboratory at this point, and you try the crowns in, and you check the margins, and everything fits, and it comes time now to take this impression. Really the right way to do it, and it's this appointment where things kind of seem to go pear-shaped, at least on the dental end of it, is you want to take these two crowns and put them in with temporary cement. If you want to cut it with a little Vaseline, that's fine too, because we want you to take these off in just a minute, but we want it on with a little more than some ortho wax on the inside. So maybe some temp on with a little Vaseline, and you put these crowns down into place, and you clean up the temporary cement. And once they're in place like that with this loose kind of weak temporary cement, you can go straight to the impression and take the impression. When you pull it out, the vinyl should lock in here, and we're going to pick up these two crowns that had a little Vaseline in the temporary cement, and it's going to get sent to the laboratory that way. That's going to make it very easy for us to get a partial back teeth that fits well. Some doctors will permanently cement these crowns in place and then take an impression over it. That's going to be really difficult for us to make something that's going to fit for you without a ton of adjustments on your part. And part of the reason is we would absolutely need an absolutely accurate full arch impression here, not only of all the teeth, but of the attachments too. There are analogs that we can set in place over here that'll help that impression work. In fact, the ERA ones are actually very nice and work well, but really the best way to do it is do not cement these crowns permanently at this appointment. Put them in with a little temporary cement. Maybe it's got some Vaseline in there as well, and pick these up in the impression and send those to the lab. And then that's really going to work well when we get to this refractory model. And here's one that's been half waxed. In fact, that's this one that we were just looking at, actually at its half waxed portion right here. We just did half of it and not the other half. And you can see how accurate and how nice this fits. This is done on a highly accurate model, and you can see the crowns are now back in place, and we've got the housing in place here where we're going to hook onto those strategy attachments. And so the wax up, this is duplicated with a silicone, like a polyvinyl material, not a hydrocolloid material, which isn't as accurate. And we've got the fine grain refractory stone and investment material being used. So if we get the crowns back, we're going to do everything that we can do on the lab end to make it as accurate as possible as we wax over these and send it back, so that hopefully when you try it back into the mouth, everything snaps into place. So the key takeaway is do not cement these crowns in permanently and take an impression and send it back. That's going to be really difficult for us to make that correctly. It can be done, but again, we're just looking at things, we're looking at strategies and tips we can give you so that this is going to fit the first time you go to the mouth with it. So making sure that you pick up these crowns and send them back to the lab in your master impression is going to go a long way to making that fit. And I wanted to introduce you as well to the strategy attachment if you have not seen this one yet, because it's definitely one of my favorite attachments. You know, there's so many out there, and most of them probably you've never even seen before. It's just the labs that are involved with them. But between the strategy and the ERA, we've had a lot of success with doctors who maybe only do 2 or 3 of these cases a year and aren't extremely familiar with these. Again, we can work with any system any attachment system you want to work with, but you're going to find that we tend to recommend these 2 just because we find less remakes and higher patient and doctor satisfaction with the ERA attachments and the strategy attachments as well.